patients that came, and they were, this is back 30 years ago, I'm very old, anyway, but they were mute, they were self-harming before self-harming became very common. They were engaging in suicidal behaviour and they weren't telling us what was going on. And I was in an inpatient unit and we had a few children there. Some of them were engaged in sexual behaviour. One boy was assaulting other children and put sticks up the local girls, and he was about 11. And he'd been doing this for a while. And I said, what is going on here? And he was telling us nothing. And there was a number of kids like this, and we really need to find what is going on. So as we were working with them, it gradually came out about various incidents of rape, intrafamilial, extrafamilial, blah blah, loads of different sex going on a long time. And we looked at what is going on here, and these kids can't tell us. And why can't they tell us? And they couldn't tell us because well, they've been threatened in all cases. Don't tell me or I'll fucking kill you, etc., or what I'll do to you. But the other thing was they didn't have a language. They hadn't words to put on it to say what had happened and these things that happened. And how do you describe that when you're small? So at the time I was working, and the other thing is these kids thought it was their fault. And children do. If something bad happens, let's say Mammy dies when you're about 5, you must have done something terrible bold, it was because you didn't eat your dinner today and that's what did it to her. So this is the way children think. So we were looking at how to help them communicate, and a colleague at the time, a psychologist, and we thought, God, it'd be interesting to be able to see, could you have a language for these children? Could you put things in a way that would help them to be able to say what was happening to them? So we did a good bit of research and but one thing we came across was devising a system that kids needed to learn, and it was really getting aware of what they felt and getting some awareness to be able to say, and we simplified it at the time into yes feelings and no feelings, and no was feeling unsafe. The other thing was that about if you felt unsafe, what do? You tell someone you trust, and you keep on telling until someone helps you. What sexual abuse hangs on and continues and is perpetuated by is secrecy, and it's because people are silenced and children are silenced and they don't tell. So that was something that needs to be addressed, and the idea behind that was don't keep a secret. There's good secrets and there's bad secrets. This is child, it's a good secret if Daddy says don't tell anybody about this, and it's about Mammy's birthday cake that's hidden in the press behind the thing, just in case she doesn't see it, or Mam, the present for Mammy her birthday, which is a nice secret and a good secret. And the bad one is that, you know, I've sexually abused you, and I've let you smoke a cigarette, and I'm going to tell your Mammy and Daddy you were smoking. So if you tell them about our little game. So it's all these kind of endless kind of little ways and tricks that are used to engage children in keeping going. So we looked at this and devised a curriculum for children addressing all those things, also incorporating it's not your fault. If these things happen, sorry about the time. But clearly that wasn't enough, and then for children to tell, you need to have people prepared to listen. And not only have people prepared to listen, they have to hear and they have to take it in. And I suppose we looked then at developing, we looked at the curriculum for the children based on the way kids think and the way we had characters of the time in TV and got those mobilised. We got volunteer people helped. This really is a development programme in Ireland. I suppose what it really is about, I suppose, which is a very underdeveloped 30 years ago, particularly in the area of sexuality, was extremely fraught. And I can remember, you know, if you mentioned the word sexual abuse, it's like you were a pariah, really. It was something serious and wrong. Anyway, but anyway, parents need to know, they need to hear what's happening, they need to have an index of suspicion, they need to listen to what their children are saying, and they need to believe them when they're saying things. Also, they need to understand when children say, I don't like Mr. Mary Fitzpatrick's father, what's that about? You don't see, you don't like him, that's great, let me finish on with the dinner. No, what are they saying? They're telling you something. And the child says, well, I told my mammy all about this. And he said, what did you tell her? I told her all about so-and-so's father. They think they've told you, but you haven't heard it or haven't picked it up. It's about picking up those things as well. And then how do you get to an audience? How do you get to actually do something that people can hear this information? And one way is in schools, because kids are captive in schools, they can't get out. And you know, it's how to get big populations together, like CAD immunisation programme. They're all there and they can't run away. So there's a bit of that in it as well. And therefore teachers need to be able to understand what's going on and to be able to tell the kids about this. You have to use educational methods that mean something to the children, modern methods, and you have to do it at a developmental level. So obviously how you talk to a 5-year-old is different to an 8-year-old, is different to a 10-year-old. So you have to have your language adjusted in ways to get across. And teachers, primary school teachers all know this. This is old hat to them. So, but it's a matter of getting these concepts across in a way that, that the kids can understand. At the time, the difficulty we had is the teachers didn't like these concepts and were afraid of them. Big problem. And it took a long time for teachers to begin to feel at ease to be able to take these concepts on board. And it reminds me of all these projects people are talking about, it's very similar, the resistance and the barriers that are there all the time. The stakeholders in this whole project involved, we were involved with them, there was a church, because the Catholic Church is the Catholic Primary School Managers Association, and 30 years ago the vast majority of schools were Catholic Church managed. So there was those, there was the archdiocese which is involved in the education, and there's the teachers' unions, and these are all bodies we had to engage with to try and build a consensus about maybe this problem should be sort of addressed in some funny sort of way, maybe, you know. And that took quite a while, and that consensus had to be built to get those involved. But eventually it was, and we had a programme for schools that's at 4 tiers in level, and there's a section for children with disabilities, and children who are blind and deaf, and the programme is adjusted to them so the teachers can get across those kind of the same basic concepts across to them, and parent and teacher education. 30 years later, it's now, the programme we have, it's about 99% of schools, but it's been a very long road. There's been a huge amount of resistance, there's pockets of resistance, and there still is. I know this is terrible, but I mean, having talked to lots of different people in the church, you can see now why they were very obstructionist and against us at the time, and they were. And I didn't kind of understand, we're all thinking about, well, maybe you should look at this again, and why are you thinking about that, and shouldn't you review this? And yes, they were right, you should keep reviewing what you're doing, and everything can always be better. But there was an obstructionist element there quite a bit at the time, which had to be overcome, and luckily we did. And it was really, I suppose, driven from the health side, and education came on board and got involved in the whole thing, and so was able to move on. The issue now, I suppose, is that how to keep this going, and how to keep the difficulty, and it's about a systemic issue. The programme is in all the primary schools, it's on the national school curriculum, but it's driven by CORE, which is the Child Abuse Prevention Programme, which I'm one of the directors, and we're involved, and we keep the health and education bit together. The Department of Education want to take it over now, and will say, well, you know, why don't you just go away? And every time they think about it, we say, well, that would be great, yeah, if you do the way it should be done. And then what they would do is they drop the parent education bit, and they, you know, reduce the teacher training, because really it's all about the curriculum, because that's what they see, and that's the problem. And how to keep that going. Any ideas? I'd like to hear them. How to keep that going. But that's really. I better stop now before we've gone over time. But,